So, very good morning, very good afternoon, good evening, everyone. So, in this series on SLR, meta-analysis, scoping reviews, grade analysis, we are going to discuss next about detail about scoping review. In earlier video, we have discussed about what actually the scoping review, how it is different from SLR and meta-analysis. So what actually the scoping review? We already discussed. Scoping reviews exploratory projects that systematically map the literatures available on the topic. So this word importance, you are mapping the literatures which is available on particular XYZ topic. And another important word is systematically. So as I told you in earlier video as well, scoping review doesn't means you should not uh, do the work in a systematic way. You have to do the mapping of the literatures in a systematic way. So that's why there is a systematically, but you are doing the mapping of the literatures which is available on the particular topic. So that make it different from SLR as well. Identifying key concepts and theory, sources of evidence and gap in the research. So you want to see what is the gap in the research. So in that cases, scoping review is useful. So, why scoping review? Why there is a need of scoping review? So, why scoping review? To examine when you want to examine extent, range, and nature of available research on particular topic. And that in that cases, your questions, research questions are very broad. You want to see what actually exists in the literatures on this particular topic. So, scoping review is the best choice to do to understand the current state of evidence. You want to see what is the current state of evidence on this particular topic. And results of the scoping review can guide you whether you can go for a SLR, systematic literature review, after the completions of the scoping review. You can identify the research gap if you are a master students, PhD students who are designing your research projects. So you can conduct first a scoping review. By conducting the scoping review, you will get an ideas what actually exists in the literatures, and then you can by scoping the review you can identify the research gap, and then you can design your research proposal in a better way. And it's useful, the scoping reviews are useful when area of research is new. So when your current research area is very new, and you don't know what actually exists in the literature, or your area is emerging literature, emerging areas, like there are many areas which are come up like CAR T cell therapies, immuno-oncologies, and 3D cell cultures, and so on. So when your area is new and emerging, so you can do the scoping review. As I said, many of you might know about uh, cell culture, cell lines, and now we are talking about 3D cell cultures, we are talking about cipherinoids, we are talking about organoids, we are talking about organ on chip, and so on, right? So these are, one of the emerging areas when we talk about pharmacology or, some health. So these kind of area which are emerging, you can do the systematic review is the best choice. And when your, you knows that uh, studies which are available in the literatures might be heterogeneous or complex one. So scoping review is the best choice to do. You can plan for a scoping review. Uh, Now, next is what type of research questions you can get the answers by conducting the scoping review. So, what kind of questions? Like you can see on your screen, question is like your question is you want to see how this particular concept has been defined within the literature. So, scoping review is the best one to answer these questions. What type of research has already been undertaken? So you want to see uh, on particular topic what kind of research has been already undertaken. So scoping review is the best choice. What policy document already exist on that this particular matters. what strategies and outcomes are being used, what methodological approach is being followed within the current studies. So these are the, some of the questions which you can get the answers by conducting the scoping review. So what I mean to say, if you have such kind of questions in your mind, so you can plan for a scoping review. Now, this is the focus of our today's talk is what are the different steps? How to, if any one of you want to write a protocol, so how to write the protocol for the scoping review. So what are the different steps? Of course, first you have to identify the research questions, and your research questions should not be narrow. Your research questions should be broad. That is the first. And after that, you have to write the protocol. And in protocol you have to define each and everything. So you have to be establish your eligibility criteria, like in systematic literature review you are doing, what kind of studies you have to include, what kind of studies you have to be exclude, and you have to be select more than one database. So to get the studies, you have to search the databases like your Embase, PubMed, you know it's always recommended that whenever you are planning for scoping review or SLR or any other, you have to be, collect the literature data from more than one database, and you have to search for a gray literature as well. You have to screen the title. Next step is you have to be screen the title abstract by two independent researchers, as we are doing in the SLR. So two independent researchers should screen the title and abstract on same topic. So for example, at initial search, you are getting uh, 2000 studies. So these 2000 studies should be screened by two independent researchers, right? So, and screening should be based on title, abstract, and based on full text. These all screenings of the studies should be done by the two independent researchers, and extraction of data also by the two independent researchers. And then you have to be presentations of the results. You have to present your results. You have to use the flow charts, identify implications for the research. So these are the steps which you have to follow if you are planning for a system scoping review. So now questions which might arise in your mind, whether there is any reporting guidelines, whether there is any the standard format which we have to follow for this scoping review. So every one of you might know about Prisma when we talk about so preferred reporting items for systematic review and meta-analysis. So Prisma has provided the extensions for the scoping review, so that we call Prisma SCR, and it's published in 2018. And if you go through it, you will find there are a checklist which contains 20 essential reporting items. So Prisma is a reporting guidelines. So how to report the results, how to report the scoping review results. So Prisma SCR is there. So these checklist contains 20 essential reporting items and two optional items to include when completing a scoping review. So what are these? So as per Prisma SCR, uh, your title should identify the report as a scoping review. For examples, on XYZ topic, you have planned the scoping review. Uh, for example, what is the incidence or prevalence of Alzheimer disease in South Asian populations? So, in title, you have to mention it's a scoping review. If you are not mentioning that scoping review, it means that you have not followed the guidelines, right? Uh, for examples, if I can say you, as I said, if your topic is, for example, I am just putting any random topic. So, how to prepare the, so for example, efficacy, interventional review, efficacy and safety of monoclonal antibodies. So if I am putting title like this, only this up to this, so it indicate that I have not followed the guidelines. So I have to mention in the title, it's a scoping review. So don't forget this, you have to add this. Like in systematic literature review also, you have to mention it's a systematic literature review and meta-analysis if it's a meta-analysis. Got it? So scoping review. So your title should identify it's a scoping review. So this is very important. Whatever the title you have given, but at last in titles, researchers should identify from the title that it's a scoping review. That is the first points when you are designing a titles. Then you have to provide the structured summary, and summary will provide the concise descriptions of the aims, methods, findings, and conclusion of the scoping review so that they can be easily identified by the knowledge user, right? You can identify the additional detail in the structured summary such as funding and registration number if it's available. When available, yeah, registration number of what? Registration number of the protocol, right? Then there is a rationale. So in rationale, yeah, rationale means why you have conducted this scoping review. So it should be comprehensive. It should describe the main concept of the research topic, important definitions, and existing knowledge in the field. So it provide a clear rationale for why the scoping review method is appropriate to address these research questions or objectives. So again, as I said, rationale is very important. Rationale means why you have conducted this scoping review for this particular topic, right? So you can see that you have to provide a clear rationale for why the scoping review method is appropriate or why scoping review is appropriate to address these research questions or the objective which you have designed. So that is a rationale, right? Why you have conducted scoping review, why not SLR, why not meta-analysis, why not a DTA, right? That is your diagnostic testing accuracy review. Then after rationale, you have to add the objectives. So objectives should be clear and explicit statements about the objective and research questions which you are going to address. And you have to identify the key element of the research questions that were used to conceptualize the review focus using framework such as PICO. I hope the persons who are working in evidence synthesis, everyone knows about PICOs, right? P stands for populations. You have to define your populations. You have to define your interventions. You have to define your comparator. You have to define your outcomes. Sometimes you will find PICO ST as well after this. So S is study design, T is time frames, right? So what it's not limited to Pico. You can do the spice. That is the S is settings, P is populations, I is interventions, C is comparisons and evaluations. For PCC, PCC is P is populations, C is concept and context. So what I mean to say, your research questions, so the identified research questions which you are, which you have planned, uh, these should we use these frameworks. So your research questions should be designed in such a way, and you have to be use these frameworks. You can use the PICO, you can use the SPICE, you can use the PCC. So it depends upon what kind of research questions you have, right? Then protocol and registrations. So as in earlier video, I also told you, don't be confused that scope it's a scoping review, so there is no need to write the protocol. You have to write the protocols for scoping review as well, and you have to register these protocols with register uh, as if you remember, I told you in earlier video as well. Prospero did not register your scoping review protocols. What you can do the registrations with other registers like OSF, that is the Open Science Framework. So you have to develop a protocols, include informations on how the protocol was developed, provide explicit details on how to assess the protocol, including informations on how to obtain a protocol if it's not publicly available. And in these sections, if you have to go for a registrations, so whenever you will go to the registration numbers or link, you have to mention it in these sections. This protocol, the protocol of this scoping review is registered with this particular register, and this is the registration number which is provided by the that register. So you have to cite when performing and updating the existing review. Eligibility criteria, as I said, in scoping review also you have to describe the eligibility criteria with rationale for why these criteria were selected. So eligibility criteria is, inclusion and exclusion criteria. So these are very important. So according to the research questions, which type of studies you are going to include and which type of studies you are going to exclude. So you have to identify any specific restriction is there. You want to do the scoping review for last 10-year literature you want to see, so you can put the restrictions on the date. You want to consider only those articles which are published in English language, so that can be done, that were included as a part of eligibility criteria, and provide a rationale for each. So you have to provide why you want to see the literature in last 10 years only. As I said, if there is emerging techniques and that technique has been developed in, for example, in 2020 only, so you have a reasons. That's why you are going for a literature for last 10 years only, right? So such kind of, you should have a reasons why you are going to put such kind of restrictions. Information sources. So next is ensure a comprehensive literature search is done, which is very important, which may include both published and unpublished studies. So unpublished studies, sometimes we call it a gray literature. If someone called include the gray literature, why you have not included the gray literature? So gray literature, what does it mean? It means that the studies which are not published, so unpublished studies we called sometimes called it a gray literatures. So we have to be include both published and unpublished to reduce the publication's bias. So report all the information sources published and gray included in the search. Report the date of the literature's search was last executed to show how the current information within the review is. So you have to be, include the date whenever you are doing the searching of the databases. You have to mention from which date to what date you have searched the databases for this particular topics. So provide a detailed descriptions of whether the search was supplemented with the scanning of reference list of the relevant reviews, hand searching, key journals, and etc. So you have to provide these informations in your scoping reviews. Then next is your search, and report the search in a manner that allow for easy replications by the others. If someone want to replicate your studies, so that researcher can easily replicate only when you have mentions each and everything clearly. You have mentioned how you have searched the literature, what search strategies you have used. If you have extracted the literature from the PubMed, if you have extracted the literature from the Embase, so how you have make the entire search strategies, you have to provide the detail. So provide the entire search strategies for at least one database, either in the text or table, or it's you will find in some journals. Authors are providing these informations in the supplementary files. So report details on who developed and executed the search strategies. Uh, Sometimes it can be information specialist, and whether the search strategies was peer reviewed by another librarian or researchers using the peer review of electronic search strategies checklist. So there is a press checklist. You have to cross check it whether these are reviewed by the experts in the field and followed the press checklist. So provide a detailed account on how sources of gray literature were searched, and document and report all the search limitations and filters if you have applied any. As I said, if you are applying the filters on particular language, you are providing the filters on particular years, you are providing the filters on, study designs. So all these you have to provide these, why you have put these kind of filters. According to your research questions, you have to put the filters as well if it's required. Then selections of sources of evidence. So state the processes for selecting sources of evidence, that is the screening and eligibility, including in the scoping review. So you in this process, full screening process, number of reviews, duplicate screening, verifications, inconsistency or disagreements if there is, of course, when same work is done by the two individual or two independent authors, so it's obvious that you will get the disagreements. So if there is a disagreement, so how these disagreements has been resolved? I hope you are getting my points. As in earlier slides, what I told you, when we are doing the screenings, when you are extracting the data, so all these processes has to be done by the two independent researchers. So as I said, for examples, hypothetically, is after initial search, you are getting 10,000 articles. So now you have to screen these 10,000 articles. Initially, you are searching based on screening based on titles and abstract. So all this screening process has to be done by the two independent researchers. So for example, two students are doing the same work. So when same work is done by the two independent researcher or two independent students, so it's obvious that you will get the disagreements. So now how these disagreements were resolved? So you have to consult with the third authors or third researchers or experts. So, so that disagreement can be, for example, according to one student, this study is important as per these research questions. But by the other students have another explanation, no, this studies should be excluded. So this is a disagreement. So it has to be resolved by the how you have resolved such kind of disagreement. So normally how we are resolving disagreement, we are discussing with the third experts or third researchers. So you have to mention the details, how many disagreements are there and how you have resolved that disagreements. Then data charting process, use a clear and comprehensive data charting form to extract relevant informations from the included sources of the evidence and describe how items were selected for charting, the software used, how calibrations was carried out among team members. So provide detail on the full charting process, including how many reviewers charted, whether this was done independently, how inconsistency in the chartings were resolved, how the data were verified. So all these you have to be mentioned in your scoping review. And data items, so you have to be list and define all the variables for which data were sought and any assumption and simplifications made. Include final version of the charting form either in the, so you will find it normally in the appendix or supplementary files with clear definitions of each items. So you have to be provided in the supplementary file. Then critical appraisal of individual sources of evidence. So perform this step. It is relevant to the scoping review of objective. So normally in scoping review objective we are not doing the critical appraisal, but if it's relevant as per your objectives, you can perform this. But you have to provide an explanations or rationale how the appraisal align with the review objectives. That's important. Then you have to synthesize the results. So you describe the plan for synthesize the range of evidence included to answer research questions and objectives. Detail how evidence will be presented, which may be in narrative format, table, visual representations. You can map or diagram. So you can present your results uh, in your own way, so that the objective is so that reader can understand it in a better way, right? Selection of sources of evidence, you have to mention, you have to give number of sources of evidence you have screened, assessed for eligibility, included in the review with the reason for the exclusion at each stage. So you have to prepare a separate files in which you have to mention these many studies I have excluded and these are the reasons for these individual studies which I have excluded. So, and of course, there is a flow diagrams. You have to present how many studies you have included, how many studies you have excluded. So, always report the reason for exclusions at the level of screening. Then, characteristics of sources of evidence. So, describe the characteristics of each source of evidence along with their references. So, in this one, you provide an overall summary in the text with more detail for the individual sources of evidence in table and appendix as needed, right? Then result of individual source of evidence, report all relevant outcomes data for each source of evidence. report these informations again as a supplementary file if you have a large number of evidence sources to be included in the manuscript. So it's not possible to include in the main file. So you can include it in a supplementary file where you have compiled the results of all the individual sources of the evidence. So it depends upon particular topic how many studies you are getting. Then synthesis of results, present data in the synthesis you will find in already published scoping review. You will find the map, you will find the framework. You can describe it narratively so as best convey the finding uncovered in the scoping review. Then you have to provide the summary of evidence, summarize main finding, and link them to the original review questions and objectives. So whatever the your research questions, whatever your objectives, you have to summarize, so what main findings, how these main findings are linking with that objectives and research questions. So tailor overall finding of the scoping review to the relevant knowledge users such as policymakers, healthcare providers, patients, or consumers. Then limitations also you have to be mentioned. Focus on the limitation of the review process as well as extent of informations uncovered. Make note on any deviations if you have deviated from guidelines or protocol with rationale why you have not followed that particular guidelines, particular protocols, and their potential effects on the results. Conclusions provide a general interpretation of the results with respect to review questions and objective as well as potential implications or the next steps, right? That is your conclusion of your scoping review, how to write the conclusion of your scoping review. Then funding, you have to document the source of funding reported in the individual evidence source. Report all the source of funding received to conduct current scoping review. Describe any role of funders in the scoping review. Report the contact number of the funding source if applicable, right? Then it's always advisable whenever you are planning for a scoping review, involve a team. It's not a single individual person work. You have to involve a team, include a methodological experts, include a subject expert, include a biostatistician, include a person who knows the process, right? So you have to prepare a team uh, to do the scoping review on any topic. Challenges with the scoping review is one of the challenges. There is a lack of people who are trained in scoping review methodology. So if you want to get expertise in a scoping review methodology, you can check various documents, various guidelines by the JBI as well. Uh, you have to go through it, you have to read it, you have to understand it. So current challenge is many are not trained in these particular methodology and determine when a scoping review is appropriate. So that is also one of the challenge. Students are doing randomly the scoping review on XYZ research questions. Maybe on that research question, scoping review is not the most appropriate options. You can go for a SLR, you can go for a other types of review, but you are selecting it and you are selecting it inappropriately. So that is also the one of the challenge with respect to scoping review. Quality is also, if you go through a literatures, the scoping review which are already published, that is of not good qualities, that have not followed the methodologies, that have not followed the reporting checklist and so on. So these are the challenges and challenges with respect to scoping review, and I hope within the times people will get the training on these scoping review methodologies and they will understand it better. So our qualities of the scoping review is also going to increase. So conclusions, scoping review are a specific type of evidence synthesis that can use to answer, again word is broad questions from the researcher and decision makers. So when you have a broad questions, you can go for a scoping review and scoping review will provide an answer to your questions, what actually exist in the literatures. And scoping review, this is another important thing is should develop a prior protocol. As I said, you have to write a protocol and you can submit that protocol to the registry like OSF. OSF is Open Science Framework. So I can show you Open Science Framework. You can do the registrations there. As I told you, if you are going for a Prospero, which is well-known register for registering of SLR, But SLR is not going to be scoping review is not going to be considered by the Prospero, but you can do on the Open Science framework or Figshare. And you have to follow you can follow the JBI guidance documents on the conduct of scoping review, and you can report according to Prisma SCR, right? That is the extension scoping, Prisma scoping review, right? So this is all about scoping review. I can show you some of the scoping review which are published in a very good journal. You can see Lancet. Lancet is one of the prestigious journals. So you can see this is the latest in March 2025. The one scoping review on inflammatory bowel disease in South Asia, a scoping review, just a scoping review. And they just find their research question is they want to see what is the prevalence and incidence of inflammatory bowel disease in South Asia. What are the different factors which are affecting it? What are the comorbid conditions? So you can see that for this scoping review, they conducted a systematic search to identify all observational and interventional studies, right? But in SLR, we are not going to include all observational and interventionals, right? For meta-analysis, you are going to include either interventional or observational. We are not mixing the different study designs. But you can see the beauty of scoping review. You can consider all because you want to map the literature, right? So you can see that this is the one of the scoping review which is published. You can see they have considered scoping review and summarized under the domain of epidemiology, natural history, phenotype, comorbid conditions, therapeutics, psychosocial health, and they have done this, scoping review and published in high impact journal. So why I have shown you this scoping review. What I mean to say, scoping review doesn't mean it's of less qualities or so less weightage than SLR or meta-analysis. You can see that this scoping review is published in a Lancet journal, and Lancet is one of the reputed journals in the medical field, right? And you can see with respect to JBI evidence synthesis, you can find this document as well, updated methodological guidance for conducting of scoping review. You can go through these. You can see that in Nature as well, there is an article on the scoping review. You can see that this is published in 14 June 2025, a scoping review and evidence gap analysis of clinical AI fairness, right? And another things which you might noted that the word scoping review in the title is there. So that's why when you're writing as per the guidelines from the title, it should be identified that it's a scoping review, right? So this is published in Digital Medicine's Nature journals. You know, you can see that. So again, why I am showing these articles, which is one is published in the Nature, another one is published in the Lancet, that scoping review can also be published in the highly reputed journals in the medical field. So this is all about scoping review. Uh, Next, we will discuss some of the important points again when you are writing the scoping review, how to write the scoping review, and then we will move to SLR, what is systematic literature review, and when we have to plan the systematic literature review, and what are the different steps to do the SLR, how to make the search strategies. I have not mentioned here, but we will include it, how to use the mesh terms, that is the medical subject headings with Boolean operators, how to make the search strategies for PubMed, Embase, and other databases, and how to do the screening with the help of AI-based tool like Rian, how to do the screening process and how to design the data extraction form, how to pool the data, and then if there is a possibilities, depending upon the data, whether we can do the meta-analysis or not, that we will discuss in details meta-analysis steps separately. But after this, we are going to discuss about SLR, that is a systematic literature review. If any one of you is planning to do a systematic literature review, we can do it. So thank you so much for your time. I hope if you have any questions, any doubt, you can mention in the comment So I will try to answer these questions, whatever the doubt you have on scoping review. Thank you so much.